Good morning, it's Ralph Bailey.
Good morning.
I have two questions. One, I wanted to go back and go over Dr. Dan Erickson's theory. Everybody in the medical profession, the AMA, local doctors, call this guy wackadoo. 3 months into it, the stats have stayed pretty steady to his theory. A lot of cases, low deaths outside of 65 plus, and folks with pre-existing conditions. Ryan just reported 8% positive, 96% recovery. Does the county still color this guy crazy, his theory of herd immunity in Sweden, which never closed, and whose numbers relatively are right on par with ours? You guys still think this guy's nuts?
Hang on one second, Ralph, and we'll have public health respond first.
Hi, Ralph. Coronavirus 2019 remains a novel disease. We continue to do as much research as we possibly can based on the data that we have incoming, and we hope to have more insight on different measures that could potentially be taken if they should change from what we are currently recommending for our community as we have more information on the disease.
Okay, but my question was, do you all still believe that Dr. Erickson's theory of herd immunity is not sound?
I think both Ryan and Bryn are going to respond.
Hi, Ralph. We actually never took a stance on the statements made by Dr. Erickson. That was actually made by two medical societies, nationwide medical societies, who
Do you have an opinion? Do you have an opinion now?
Who released a letter indicating that there was not sufficient evidence to support the claims that were being made. As the public health department, we feel that this is a novel disease, and we are going to continue to do some surveillance and research on the information that we have coming in to make decisions based on that information.
So, but is there you don't have any statement on his theory now? Oh?
Hey, Ralph.
Hey, Ryan. Mr. Alsop.
I would, so to Bryn's point, the county never took a stance, to my knowledge, on those comments. I can only tell you just from my personal comments, my personal thoughts on the matter are that I think Dr. Erickson is courageous, and I think that he made a lot of good points when he talked about the numbers and the data. I think he said a lot of important things in his long press briefing that he had. There are, many different opinions coming from many different places about his comments, but I think he's a courageous doctor. I think he, spoke his mind, and he told everybody what he believed, and so for that, I think he gets a lot of credit for being courageous and stepping up early on, and that's as honest and thoughtful as I can be on the matter.
Okay.